Repair, non-union or malunion, femur, distal to head and neck, without graft, e.g., compression technique. With iliac or other autogenous bone graft, includes obtaining graft. The physician makes a lateral incision to expose the femur. If there is no distortion of the intramedullary canal, intramedullary nailing is performed for fixation of the non-union. If failed internal fixation is present, the physician removes the plates and screws. If there is malalignment of the medullary canal, a compression plate and screws are used for repair. The physician harvests bone with an osteotome from the iliac crest or from the femur itself and closes the surgically created donor site. Copious amounts of bone are placed around the non-union site. The incision is repaired in layers and a temporary drain is applied. Repair, primary, open or percutaneous ruptured Achilles tendon. With graft, includes obtaining graft. An incision is made overlying the tendon. The physician extends the incision through the tissues to the tendon. The physician identifies the tear and debrides any rough edges. The physician repairs the surgically created graft donor site. The graft is incorporated into the repair of the tendon and secured to the area with fixation, e.g., screw. The tendon is repaired, typically with a heavy non-absorbable suture. The wound is irrigated with antibiotic solution and closed in layers. Repair, secondary, ruptured Achilles tendon, with or without graft. An incision is made overlying the tendon. The physician extends the incision deep to the tendon. The tear or rupture is identified. Because the repair is secondary, significant scar tissue may be debrided. Any non-viable tissue is also removed. The physician repairs the surgically created graft donor site and the tendon with a suture or with both the graft and suture. The graft may be secured to the area of repair with a screw. The physician irrigates the wound with antibiotic solution. The wound is closed in layers. Repair, fascial defect of leg. The physician incises the skin overlying the defect. If underlying muscles are herniated through the fascial defect, they are pulled to their correct anatomical position and secured with sutures. The wound is sutured in layers. Repair or suture of flexor tendon, leg, primary, without graft, each tendon. Secondary with or without graft, each tendon. An incision is made overlying the damaged flexor tendon in the leg. The physician extends the incision deep to the tendon. The tear or rupture is identified. If the repair is secondary, significant scar tissue may be debrided, and a graft may be necessary. Any non-viable tissue is also removed. The physician repairs the tendon with sutures or by placing a graft and suturing. The graft may be secured to the area of repair with a screw. The physician irrigates the wound with antibiotic solution. The wound is closed in layers.
Repair dislocating peroneal tendons, without fibular osteotomy. The physician makes a longitudinal curved incision that extends from the distal end of the fibula, over the lateral border of the foot to the cuboid bone. A posterior skin flap is elevated at the lateral malleolus, using the deep fascia with its base attached to the tip of the lateral malleolus. The peroneal tendons and sheaths are identified and placed in their appropriate anatomic position and secured in place with sutures or drill holes and suture anchors. The incision is sutured in layers.
Repair dislocating peroneal tendons, with fibular osteotomy. A longitudinal lateral ankle incision is made in a groove created in the posterior aspect of the fibular malleolus, fibular osteotomy. The peroneal tendons are placed in the groove and held in place with a thick osteo-periosteal flap from the surface of the malleolus that is swung posteriorly over the tendons, or with a wedge of bone cut from the lateral malleolus that is displaced posteriorly over the tendons. The wound is irrigated and sutured in layers. Repair of congenital pseudarthrosis, tibia. Surgical repair using fibula graft or using the Elizarov technique of repair is often used.